I like to believe that with every test kit that we distribute, it's another opportunity for somebody to take control of their sexual health.
You really came on board and changed the program, essentially. Kudos to you.
Thank you.
What is self-testing?
HIV self-testing is a scenario in which a person can take an HIV test and do it at home, the privacy of their own home, rather than having to go somewhere in person. It's very convenient. For our program, we use the Quick in-home HIV test, which is the only approved over-the-counter at-home HIV test.
Welcome back to another episode of Keep On Loving the Podcast. My name is Javontae Lee Williams. I am your host for this segment, and this is going to be a good one. I'm so happy to be joined in studio with our guest. First of all, I hate when broadcasters say, I'm so happy to be joined in studio by our guest. Talia was not happy, but I really am happy you're here. Who are you?
My name is Brian Hernandez.
Brian, and what do you do?
I work under you.
Oh, that's right. Brian and I work together at the Philadelphia Department of Public Health in the Division of HIV Health, sponsor of this podcast. You can visit us at phillykeeponloving.com. You'll see all of Brian's handiwork because Brian manages that brand. But we're going to talk about testing yourself. So before we get there, how did you become a public health worker?
That's a great question. Let's see. So when I was about 14, I was diagnosed with type 2 diabetes, and that kind of changed my life completely. I was very interested as a kid going into a creative route, going into animation. I was really interested in drawing. And then diabetes kind of really took over my life in terms of just, constantly checking my blood sugars, kind of restructuring my day-to-day, going to school.
Did you have to stick your fingers?
Yeah, I did the whole, the needle prick. I started off with those long needle injections for insulin.
At 14?
At 14. I was very, 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 very sick, and it happened pretty suddenly. But with that, I kind of got more interested in healthcare and health science. So for a while, I was really interested in medicine. I was interested in going into becoming a doctor or a nurse or any kind of different allied health professional, like a respiratory therapist or radiography. But nothing felt quite right. And then, I'm just a very a curious person. So with doing all my research when I was a kid, I was what do doctors do? What are the different types of doctors?
Did you Google what do doctors do?
Kind of, basically, what is their day-to-day? It was just looking at the niche things. And then I came across just learning about public health and public health science. And specifically, I learned about epidemiology. And that
epidemiology.
Yep. And so from there, I kind of got interested in learning, there's a way to go into healthcare and focus on bigger picture things and focus on populations rather than just one individual person. And for some reason, that just sparked my interest. I always have been curious about global health or global cultures and how different people live their lives, and learning about public health what kind of just happened. And so fast forward from high school, choosing to go study public health in college, I had the opportunity to volunteer at a local nonprofit here. Shout out to Gale. So back in 2016, I had the opportunity to volunteer with them and hand out condoms and lube and kind of just talk about HIV prevention during one of the local Puerto Rican Day parades. And so kind of from there, it was an amalgamation of
You said local. You should say legendary. One of the legendary Puerto Rican Day parades.
Yes. So it's an amalgamation of learning about public health in school. And then at the same time, I was like 17. I had just recently come out. And so I was kind of learning about coming out as gay, you know, and I learned about, you know, what it means, not what it means to be gay, but started learning about like the social climate.
That's a whole other episode.
That's a whole other episode. Gay. But here's the thing. So from like being gay, learning about public health, coming to college, and at first I found like a queer student organization, but then I came across Queer People of Color, a student org that I had joined, and they were the ones who connected us to Gale. And so with learning about HIV prevention, seeing other gay Puerto Rican people doing the work really inspired me. And so since 2016, I've been doing, my professional career started maybe roughly 3 years ago, but I like to say it started back in 2016 as a volunteer.
That's amazing. So when you said like you're interested in other peoples and populations and how they live their life, what makes you interested?
I don't know. I think it's just a matter of like we're all different, you know, like based off of our geographic, our religions, our sexual orientations. We all are on this planet and we live life differently through different sets of beliefs. And I think that's something beautiful. It's so interesting when you get to see instances in which like cultures tend to share, like, or just like similarities in terms of like cultural norms or like family dynamics, you know. I've always just been interested in that type of stuff.
And even differences, like how do this.
Completely
because
different.
I'm curious, and I ask that question because, you know, public health folk, we like to ask questions. Sociologists like to ask questions. Anthropologists like to observe and ask questions. And so my flags always go up, like red flag, when someone says, I'm interested in other cultures. But it sounds like you have a genuine interest in learning the values that those cultures have. Would you say that to be true?
Oh, yeah, for sure. I think, you know, it's never something of like, you know, appropriating or anything like that. Just like, just curious. And I think that's just been my thing. You kind of hit the nail. You know, as a person, what kind of got me interested in public health is we want to figure out why. And like why I got interested in epidemiology is like, why did it happen? Why does the disease happen? Where does it happen? How do we prevent it from next time? Or prevent it from happening from next time?
You know, one of the things that comes to my mind is that gay folk are a subculture within a culture, right? Do you look at that population and ask why certain things?
Probably, yeah. I mean, thinking about like how people may like navigate relationships in completely different ways, whether it's polyamory or monogamy.
I can tell you as a card-carrying member of the
openness.
LGBTQIA membership, as my mother asked me if I was a member of. She literally asked me, she was like, are you a member of the LGBTB guy? I was like, yes, mother, I am a member. They're delayed with my card. We navigate relationships differently. That is a fact. That's a fact. Yeah.
We do. We definitely
do.
But
I'm trying to link to your work now in HIV because a major part of what you do is really figure out ways to intervene in culture to change behaviors or to promote health. Would you say that's accurate? And I realize I'm your supervisor asking you. Would you say that that's what you do?
I think all of it is important, you know, when it comes to implementing different types of prevention strategies. You need to have a competency, a cultural competency when it comes to implementing that kind of work. You can't just, you know, go into a community where data may show like these people in this community have higher rates of new infections of HIV or diagnoses, and just think, okay, this is what the data shows us. Let's create this program. Boom, bam, you know, get it started. You know, and it may not be well received, you know, and you have to, it's important to really take those things
You know, if we were to
consideration.
write down the transcripts of this podcast and put them into like some type of printed manuscripts, one theme that comes up again and again and again is like this distrust or dislike for interventions. Because we had Dr. Tracy Gilbert on, and she was talking about interventions in Wisconsin and how she was subjected as a young black woman, episode somewhere here or here. And then we had Caitlin Cunningham talking about how like the intervention she was promoting wasn't really working. And now you're talking about just putting an intervention in the community without any insight into what the community values. And I think from my perspective, I've seen that go horribly wrong as well. But the community values what you are doing because your program is like selling like hot cakes.
Hot cakes.
I realize that from this podcast that might have a different connotation. Yes, but you know, like our studio audience is laughing. But tell me about the self-test program that you manage. Because that's what's built, like that's the engine that runs PhillyKeepOnLoving.com.
Yeah, so I came to DHH in 2020, November of 2020. So yesterday was my 3-year anniversary. So I've been here 3 years.
And also thank you for doing the podcast episode.
So I believe the self-testing program started before I had come to DHH in about October of 2019.
But we weren't doing it the way you changed.
And then,
you transformed it.
No, really, it was very, very small and very, very, a very small program. And in fast forward a couple months later, COVID happens. And we were hit with the pandemic. And so the self-testing program kind of expanded from just one website where you could go order one HIV test to now expanding with community partners. And so now, you can go online, you can get a test kit, or you can go through a local CBO in the city. So, as you said, Philly Keep On Loving is the host of the program. So if you go to phillykeeponloving.com/order, you can get yourself a free HIV
sponsored
right there.
But I would also say it's only for Philadelphia residents. So we have other resources that we'll link in the show notes for anyone else in the country and, quite frankly, the world to get their own test kit.
And if you are a Pennsylvania resident, you can definitely get a free HIV test through the State Department of Health at getmehivtest.com.
But tell me exactly, what is self-testing?
So self-testing is basically, HIV self-testing is a scenario in which a person can take an HIV test and do it at home, the privacy of their own home, rather than having to go somewhere in person. It's very convenient. For our program, we use the, I believe it's called the Quick in-home HIV test, which is the only approved over-the-counter at-home HIV test. And
so these tests have to be approved?
Yes, it's approved by the FDA.
So it's like a medical device that has the clearance. So I guess that increases the trust in the accuracy. Like you could pretty much be confident in that test. Yeah.
Those the self tests are pretty accurate. You collect you take an oral swab. You collect oral fluids. So you just take a swab of the top of your gums and then the bottom of your gums. You put it in the device, and within 20 minutes, you have your test results.
I love how professional you are. I would hire you if I could.
Yeah.
So, so you mean you take the swab, you put it in your cheek, you put it in a tube. Okay, got it. So this program, like, it's not just in a vacuum. Right, like this is a part of a suite of interventions at the health department.
Yeah, we have 4 different pillars when it comes to ending the HIV epidemic. We have our EHE plan. So the self-testing program falls under pillar 1, diagnose, and I believe the goal is that by 2025, 95% of people living with HIV will be diagnosed. Is that
I think so, if I recall correctly. It sounds good to me.
And so one of our activities in order to get to that goal is to increase access to HIV testing. And the way that we do that is by, having a HIV self-testing program.
So how does, I get the self-testing. Okay, I want to know my HIV status. And I think they have other tests for STIs. So on the website, you can get like a chlamydia test, a gonorrhea test, but those are different tests, right? So what's the difference in the two types of tests?
So the difference is basically, one is the OraQuick is the HIV self-test, and then the other tests that we provide are self-collection kits. So there's a difference between self-test and self-collection. So with self-test, you can you take your swab, you put it in the device, you get your results in 20 minutes. However, with self-collection, you're going to most likely do a finger prick, and you'll put your finger on a little paper pad to collect a blood sample, and you collect your specimens. So whether that is blood or urine or a swab, and then that gets sent into a lab to get processed. So there's just the difference is that one, you get sent out to have it processed and get your results, and then the other one, you just do it home and get your results right away.
Which one do you prefer?
Well, I mean, I think it all depends on the person. Some people can wait and they don't mind. Some people might feel like, I need to know, like today. I am an impatient person. I'll be quite honest with you. If there's something like, if there's something that I want to buy, like I'll sometimes I won't even do like an order pickup. I'll go get it because I'm just like, I don't want to wait an hour and a half for my thing. I want to, if it's available, I'm going to go.
True story. I drove to Jersey last night to get a thing. So yes, I agree with you. Yeah.
So for me, I think I think the self-test kit is really convenient. It's completely free. We cover the cost of mailing, so it gets sent through snail mail in like 5 to 10 business days. You take the test, you got your results.
So a lot of people have responded to this program.
Yes. So
how many kits would you say like you've mailed out?
Definitely over 1,200 since I've been here.
So it's thousands.
It's more, I will tell you that in the last 2 years, the total amount of test kits that we've mailed out on top of the total amount of test kits that have been distributed by CBO partners has been over 4,900.
4,900, almost 5,000 people.
Almost 5,000.
Wow. And like, that's why I say, the self-test program was existent, right? But you really came on board and transformed the program, essentially. Kudos to you.
Thank you.
Because I think that that many people requesting something and being proactive about their health, like on Keep On Loving, we're all about sexual wellness, sexual health, and really like promoting ideas of how people can take agency and ownership of their health. And when you request this test, it may seem like a small thing, but it's really an act that you can do to protect your health.
Yeah, I like to believe that with every test kit that we distribute, it's another opportunity for somebody to take control of their sexual health.
Yeah, I like that a lot. So it's for Philly residents. And if you are out of Philly, there are other resources. You mentioned the state website. Are there other resources that people can request a test kit in case they don't live in Pennsylvania?
Yeah, I mean, there's even, of course, you can go to CDC's website, but there's even national programs like I believe it's called the Together Take Me Home project. So that's a project, an HIV prevention project with the CDC in collaboration with Emory University, building healthy online communities, OraSure, the company that makes the test kits, and the National Alliance of State and Territorial AIDS Directors, or NASTAD. So like with that project, their goal is, I think over the next 5 years, to deliver about 1 million test kits to people. So there's plenty of different ways in which you can get a self-test kit for free, because those things are like $36,
Mhm.
$40, you know?
I'm sensing the Puerto Rican come out of you, Brian. When you said that's like for free, because we don't got time to pay for that. Well, Brian, thank you so much for coming on and sharing about your work.
Thank you for having
me. The last
me.
time you were on, we were talking about PrEP. We got to get you back on to talk about PrEP. Will you come back?
Yes, of course.
Okay. All right. Well, thank you so much. This has been a great episode. And thank you at home for joining us, or wherever you're watching this. Until next time, keep on loving. Deuces.